November morning. We get a chance to walk, but there is more rain during the week. And I'm reading at Lee Park. As you know, I put in that suggestion for walks, and it's only a suggestion, but I have a group, and we actually do meet there at our suggested location, and everybody is welcome. Our guest this morning is Kim Campbell. Kim is a registered nurse at the diabetic clinic, and I really appreciate that she has agreed to give us her knowledge of diabetes. And thanks to Gwen Bryant, her mom, for suggesting that Kim speak to us. So welcome, Kim.
Hi, thank you. I'm very happy to be here.
Do you need screen share at all?
Yes, it was recommended by my mom that I provide a little PowerPoint, so I have done that for you.
Did you want to put it up yourself? Because you can do that.
Yeah,
okay, go ahead.
Right now.
Perfect.
There we go. Are we there?
Yep.
Okay, perfect. So yes, my name is Kimberly Campbell. I am a registered nurse, and I'm working here at the North Bay Regional Health Center and the Diabetes Education Center. I've been here since 2016, so I have a fairly good knowledge, I think, of diabetes and complications and prevention. So today's talk is going to be mostly on prevention, with a little bit of understanding of what diabetes is. Everybody seems to have a base knowledge of diabetes. Some people are going to have more knowledge than others. Some people might already be dealing with diabetes. I'm hoping that I can provide a little bit of new information for everybody here. So my objectives today are to understand diabetes, understand how it is diagnosed, understand the disease process itself, understand how to prevent or prolong a diagnosis if you are at risk, including lifestyle changes, understanding how to manage diabetes if you have been diagnosed, including medications and lifestyle, and understanding the complications associated with diabetes. So why are we taking this so seriously? And understanding the mental toll chronic disease takes on a person. So this is not just diabetes itself, it's any chronic disease, but we're going to be focusing more on diabetes today. So please interrupt me, anybody, if you have any questions, input. I'm not a huge fan of just lecturing. I enjoy input, but if you want to save questions to the end, feel free. So diabetes is a disease process within our body, and it includes two main components. So there are different types of diabetes, which I will be discussing a little bit later on, but the main thing is that diabetes is the inability of our body to use sugars or glucose properly. So we've either developed an insulin resistance, or we're no longer making enough insulin. So when we eat, the food that we eat is broken down into carbohydrates. Not every food is going to contain carbohydrates, some more than others, but the majority of foods that we eat do have carbohydrates. That carbohydrate is what fuels our bodies. So our pancreas is an organ that produces hormones, and it produces insulin. So when I say that we're not producing enough insulin, it's this pancreas here in our body that's not doing its job properly. Insulin that it does produce is the hormone that's used to take the sugar, so these little blocks, out of the bloodstream and bring it into these cells. So it's a really important function because, as I said, sugar is our body's fuel. So we need that sugar for our hearts to pump, our brains to work, our muscles to move. And you lovely ladies are very active, so you're going to need some of that carbohydrate. So when things aren't working properly, we're going to get this buildup. So in this diagram here, you've got the sugar that's coming in from the foods that we eat. This is your bloodstream. You've got insulin that's coming from the pancreas that's going to match up with these cells, and it's going to take that sugar and it's going to bring it into the cells. Now, if we're not able to use the insulin properly, the cell doesn't respond to the insulin. That sugar isn't brought out of the bloodstream and into the cells, and then it builds up into our bloodstream. Now, this is a big issue because our red blood cells are what carries the sugars to the different cells. If that sugar isn't taken off those red blood cells, then it builds up and it makes those red blood cells a lot bigger. When it goes into the tiny little vessels in our bodies, it starts to irritate those vessels, and then it can eventually damage them. And I'll focus a little bit more on the complications later, but this is, again, why we're concerned about the blood sugar building up. So to find out if you have diabetes, your doctor is going to screen you. So if you're at risk, your doctor is going to screen you a little bit more often, but usually it's every 3 years that you're going to be getting the blood work done for diabetes management. So if you're looking at your blood work, and Life Labs is a great lab that you can view your results online. Other times you just have to wait until your doctor tells you. But if you're looking at your blood work and you see that your fasting blood sugar is less than 5.6 or your A1C is less than 5.5, you're completely normal. You aren't at risk of diabetes. You don't have diabetes. You're just in that normal state. If your fasting blood sugar comes up at 5.6 to 6.0, or you have an A1C result of 5.5 to 5.9, that says that you're at risk of developing diabetes in the future. So you definitely want to take some of the information that I'm providing you today, trying to incorporate some of it to prevent you from developing diabetes. Pre-diabetes. So some people say there's no such thing as pre-diabetes, but it's just stating that if you don't do something with your blood sugar at 6.1 to 6.9 or your A1C of 6.0 to 6.4, then you're much more likely to develop complications. Then if your fasting blood sugar is 7.0 or greater, or you have an A1C of 6.5 or greater, then you have been you will be diagnosed with diabetes. A lot of times, if you get one of these results, one or the other, your doctor will do a repeat. But if your A1C is coming back at 6.5 or above, then they typically send you for some education to try and bring that A1C down. They'll repeat your blood work, and then we'll see where you're at. The A1C, let me just clarify. So this is a blood test that they do every 3 months. And the reason for that is because your red blood cells live for 3 months at a time. So it's testing how much sugar is attached to those red blood cells. So every 3 months, and it's not at that 3-month mark, all your blood cells die off. It's progressive. So the A1C is testing how many how many sugars are attached to those red blood cells and at one time. And then if it's a higher percentage, that means you've had higher sugars in your bloodstream for the past 3 months. So again, we've got different classifications of diabetes. The most common are pre-diabetes, which means you're at high risk of complications from diabetes, and it is typically managed with lifestyle. Type 1 diabetes, which means that your pancreas is no longer producing insulin. Many times this is due to an autoimmune disorder. This is the type of diabetes that's most commonly found in children, but it's not only diagnosed in children. There are a lot of adults that have had a situation where their autoimmune system has attacked their pancreas later in life, and they have been diagnosed with type 1 diabetes. Type 2 diabetes is the most prevalent diabetes in our society. This is when a person develops that insulin resistance and has lower insulin production. So our pancreas isn't making enough insulin, and our cells have become resistant to the insulin that is being made. So it's not allowing the insulin to do its job. So they're closed off, and it's not allowing that insulin to come bring the sugar into the cells. So what we need to do is find ways to open up those cells again. So we're going to be talking about lifestyle management to help with that, and also medications that can help with that. This is very much associated with a family history of diabetes. So if you have especially first-degree relatives, so that's siblings and parents that have type 2 diabetes, you are definitely at higher risk of developing type 2 diabetes. 75 to 90% of people with type 2 diabetes have a family history. As I said, diabetes is a progressive disease. So if you are a mother and you happen to have had gestational diabetes, then you are at higher risk of developing diabetes later in life, because that has shown that your body can be resistant to that insulin. So gestational diabetes is your placenta is causing that insulin resistance. But again, it's just showing that your body can be resistant. So if you had gestational diabetes, that's something you want to monitor. If you have prediabetes, you're at higher risk of developing diabetes later in life as well. So we have lots of people that come in with an A1C of 6.1, 6.2, 6.3, and then we give them the education, they take on these lifestyle changes, and then we don't see them ever again, or much, much later if they maintain those lifestyle changes. If you have been diagnosed with prediabetes, again, you can prevent it, and we use diet, exercise, and medication. So if you are dealing with weight management issues and you've been following all the diet, exercise guidelines, then there are medication options that can help, or there's surgeries that can help. But typically in our little world here at the Diabetes Education Center, we focus mainly on the diet and exercise portion. And then if you follow that for a long period of time and things don't get better, then you can talk to your doctor about some of the other options. So just wanted to mention here, when we're talking diabetes, diet is always the main thing that people come and they want to know more about. Physical activity is just as important, but everybody focuses mainly on the diet. So Canada's Food Guide, just going to bring it up here, is a great resource. And this is where we typically get a lot of our information, both from Canada's Food Guide as well as Diabetes Canada. So when you're picking up your plate, we want to focus on getting your fruits and vegetables, your meats and alternatives, and your grains and starches. So trying to find the whole grains as often as possible. So that's going to be your brown rice, your whole grain bread, your quinoa, your bulgur, your brown pasta. Those are whole grains. So keeping in mind that anything that is processed, anything that cooks more quickly means that your body can digest that faster, so that you can typically eat a little bit more. So it's going to get processed a lot faster in the intestines. Your sugars are going to be released a lot faster in your body, and that means your blood sugars can spike a lot faster. When we have a little bit of extra sugars in our body, then our body tends to store that as fat because it keeps it as the fat, and it also fills up the arteries with some plaque as well. So trying to keep the higher fiber as much as possible and trying to limit how much you're getting at a time. So this allows your body, if you have some of that insulin resistance, if you're pre-diabetic, then you want to make sure that you're not overloading your body with those carbohydrates. Okay. So Diabetes Canada has tons of great resources out there. So I'm just going to pull up a couple of them. Well, I'll show you all of them, but I'm only going to focus on a couple of them. So basic meal planning is a nice little information on what you want to do. So your healthy eating tips, which you can also find on Canada's Food Guide, watch your portions, eat healthy carbohydrates, eat more whole foods and less processed foods. Again, just for the fat content, the sodium content, and the sugar content. Eat more vegetables and fruits, limit your sugars and sweets, be consistent with your carbs, choose good fats, drink water, plan ahead for healthy meals. Again, I'm going to dive a little bit more into some of those a little bit later. Not sure what happened there. Okay, so your basic carbohydrate counting. We're going to be looking at your food labels, and I do have this on another slide as well, so you can pull that up through the recorded sessions, or you can go into Diabetes Canada and pull these up. So when you're looking at your food labels, you want to look at your portion sizes. This is key because you want to know how many carbohydrates are in what you're eating. So for this example, it's talking about 2 slices. If you're looking at breads, this is very typical. So your carbohydrates are 36 grams. Your fiber is 6 grams. We don't pay attention to the sugars. Sugars are the added sugars. They're sugars that your carbohydrate containing foods are already included in these carbohydrates. Fiber does not break down into sugar, which is why we subtract it. So in this example, you take your 36 grams of carbs, you subtract your 6 grams, and then you're going to end up with your 30 grams of available carbohydrate. So this is what's breaking down in your body into the sugars that we're using for fuel. In your 2 slices, you have 30 grams, so each slice is going to be 15 grams. So this is kind of important because you want to keep in mind that 15 grams. That's something that you're going to see throughout this presentation, is focusing on those 15 grams of carbs per serving. Okay. All right. So again, this food label, it's just providing the information in a different format. And again, it's showing you your total carbs, your dietary fiber, and your sugars. So we're not paying attention to those sugars. Women should be eating 30 to 45 grams of carbohydrates at each meal to maintain a healthy body weight. So remember I said you want to keep in mind that 15 grams of carbs. In this one, I'm just going to pull up. I'm going to exit here. And we're going to pull up this guy. So your carbohydrate foods are going to be your grains and starches, your fruits, and your milk. Milks and alternatives. So your vegetables are more or less your freebies. So you can enjoy as many vegetables as you want. We highly encourage them. They have lots of fiber to add to your meals. Your meats and your alternatives, there are some carbohydrates in some of your proteins, but usually they're not enough to affect your blood sugars too much. So definitely enjoy your proteins. There is talk in some places about saying that you don't want to eat too much red meat. So I have had people cut out the red meat, but then you can become iron deficient. So you want to just have your red meats in balance. They are higher in fat, but you still want to eat some red meats. Your fats and oils, you just want to choose the healthier ones, the heart healthy ones as much as possible. So nuts are great. There's always the debate, margarine or butter. I leave that up to personal preference. Butter is higher in fat, but some people prefer not to have the chemicals that are in margarine. Again, completely up to a person in my opinion. So when we're looking at this here, the diabetes food guide, it's saying that you want to try and get at least five servings of your vegetables in a day. So the old Canada's food guide was saying you want to get your 6 to 8 fruits and vegetables in a day. This is specifically vegetables. You want to try and get your 5 servings. Again, 5 servings can be a cup of raw leafy greens, a half cup of cooked spinach, romaine, kale, endive, Swiss chard, or half a cup of your vegetables. Again, some vegetables do contain some carbohydrates, and you want to keep in mind here your parsnips, peas, winter squash, and tomato sauce, because they are going to have some carbohydrate. So 15 grams of carbs is about 3 teaspoons of sugar. So if you're having a coffee in the morning and you're somebody that likes that sugar, just keep in mind that if you have 3 teaspoons of sugar, that's 1 serving of your carbohydrate. If you're aiming for 30 to 45 grams of carbohydrate at a meal, and you're taking 3 teaspoons of sugar in your coffee, there's 1 of your servings. So that is a lot of quickly accessed sugar that's going to be stored as fat, because it's going to spike up that blood sugar. Those sugars are going to be stored as fat in your body. Your grains and starches. So this just gives you an idea of how much 1 serving of carbohydrate is. So 1 serving is 15 grams. So if you're somebody that likes your cold cereal, half a cup of cold cereal is typical. Half a cup of pasta or couscous, 1/2 cup of corn or half a cob of corn, half a medium potato. Again, keeping in mind that 30 to 45 grams of carbs at a meal. Your sweet potatoes, 1/3 of a sweet potato. Yes, sweet potatoes do have a lot of additional nutrients that maybe regular potatoes don't have, but they also have a bit more sugar in them. So keeping that in mind. Your popcorn is always a better choice than chips, because 3 cups of popcorn is equivalent to about 16 chips. Always look at your food label if you are having your processed foods, but these are just an indication of approximately 15 grams of carbs. Your fruits, definitely enjoy your fruits. We want you to get your fruits. We want you to get the vitamins, the nutrients, the fiber from your fruits. We just want you to space them out. So diabetes or not, this is how we recommend people eat for maintaining a healthy weight. Your milk and alternatives. So having your milk is definitely something we encourage. Having your yogurt is something we encourage. I understand everybody is individualized on what they can eat. Lots of people have food intolerances. So try and fit this into your abilities and what you can eat. These are just guidelines. We always do, if you see a diabetes education center, if you have a diagnosis of diabetes, we individualize your suggestions for you. Your meat and alternatives, again, keeping in mind your beans and lentils will have some carbohydrates to them, but most of your meats don't. Those are kind of your freebies that you can eat. So a lot of people, they'll do cheeses, peanut butter on celery for a nice little snack. If you are having snacks, trying to keep it to about 15 grams of carbs, but having that protein in there. So tuna on crackers is a great option for a snack, or Melba toast and cheese, or even a little plate of nachos. Again, just looking at your food label, how many nachos can you have for that 15 grams of carbs? Adding some cheese, some salsa, some olives, some onions, throwing those vegetables on there to really balance it out, make you feel a little bit more full. So higher fiber slows the digestion down, which allows you to feel fuller longer, which means you're probably not going to eat as much.
I have a question, Kim.
Yeah.
So in the morning I like to I have 1, 2, 3, 4 fruits in a bowl with some almond milk,
okay,
and nuts.
Okay.
Does that balance out, or is that too high in sugar? Like I have it all at once, say. So I heard you say space your fruits out, so I wondered.
How much fruit are you having? Like,
Well,
are you having a whole banana, whole kiwi?
Yeah, a whole
yeah.
apple, a whole banana, half a cup of raspberries, blueberries.
So
yeah,
the nice thing about the berries is you can eat a large amount of berries. So 2 cups of strawberries, blackberries, raspberries is a large amount of berries, and that's only going to be 15 grams. If you're doing blueberries, it's a cup of blueberries. So depending on the type of almond milk you're having, if you're talking about a cup of almond milk, you might be looking at about 12 to 15 grams of carbs. And
unsweetened.
then,
Unsweetened.
It's probably closer to the 10 then.
Okay.
And then you're having, you said half a cup of raspberries?
Yeah.
And an apple and a banana. So that would be 30. Yeah, you'd probably be in your 30 to 45 gram range. Yeah.
But I'm feeling hungry about 10:30. So,
What time's your breakfast?
7:30.
Not uncommon. So, I mean,
Yeah.
that's still a 3-hour span. So
Yeah.
that's not a problem. But then I would probably just have a little snack. But you might want to add a little bit more protein, or maybe
Yeah, that's
having
what I was thinking.
a slice of toast, or just to kind of get some of those grains in there so that you're not bombarding yourself with the sugars just from the fruits, as great as the fruits are, but maybe taking one of those fruits and bringing it to a 10:30 snack.
Okay.
That might be helpful. Try
Yeah.
that.
Any questions? Any thoughts? Debbie?
Oh, okay.
I was just going to ask a question. Do you work out of the Diabetes Resource Center, or are you working at the hospital?
So the Diabetes Resource Center has been renamed the Diabetes Education Center, which used to be on Commerce Court, then they moved to King Street, then they moved to Devonshire, and in January we moved back to the hospital.
Oh, okay. I didn't know that.
Yeah, so
to access it, you still would have to go through your doctor then?
So
Or
that is something
for
that's
referral?
Yeah, so that's something that's changed since I came back from maternity leave, and they are requesting referrals now from the doctor's office. It used to be that you could self-refer, but they are requesting um, the referrals from the doctor's center or offices now. If you're part of Blue Sky, they do have their own diabetes education team. So they have a nurse, a dietitian, a social worker on staff. But if you're not part of Blue Sky, then you're welcome to access our center. We're happy to see anybody and everybody with the diagnosis of pre-diabetes or diabetes.
Can you do online appointments too?
Yeah, we do a lot of virtual appointments. So we can either
Good.
do it in a format similar to this, or we'll do telephone appointments, or we'll do in person.
Someone just commented your slideshow isn't moving.
I haven't moved it in a little while.
Okay, all right, thank you. Thanks. Any, Debbie, go ahead.
Can you hear me now?
Yes,
Okay, I couldn't get it off on mute. Good morning, Kimberly. So what do you use as guidelines depending on body size? Because if I ate everything that was on there, like my body just can't take that much food. So how do you go about keeping your levels in check, but not eating the required amounts? Do you know what I mean?
I think that's an absolutely great question. So again, these are just guidelines for overall trying to balance out those meals. But yes, everybody is very individual. So we, again, we do it based on individual needs. So when we sit down with a person, we look at your body mass index and we say, okay, and we also ask you how much you typically eat. So we're not going to bombard you with food. We want to kind of fit it in, but we just want to make sure that it's all balanced. So if you're somebody that doesn't eat a large breakfast, it's like it will say, okay, well, if you have a fruit and a yogurt, so that's 30 grams of carbs. For some people, that's plenty. Other people, no, they need their 2 pieces of toast and they need their eggs and they need their sausage, and then they're going to have a little fruit bowl to get their 45 grams of carbs. So it's very individualized based on what you typically eat, how active you are, your body size. And again, we just want to make sure that you're maintaining a healthy weight. Does that answer your question?
Well, partially. I'm just wondering how do you tell if you're getting enough without having blood work done? Like okay, I'm going to just use myself as an example. Okay, so I'm like only 4'9" and I weigh about 95 pounds. I can't eat all that food or I'd weigh like 190 pounds.
Yep. So again, we look on your body mass index, and if you have a healthy body mass index, so we calculate that by your height and your weight. If you have a healthy body mass index and you're eating and you're feeling full, then we're not going to push more food on you by any means. We just want to make sure that you're balancing out the sugars that you're eating so that you're not bombarding your body at one meal. So again, like just trying to make sure if you only want 15 to 30 grams of carbs and that's all you can eat, that's okay. We just want to make sure that you're full, you're maintaining your healthy body weight, you have a high energy level. That's more of what we want from people, because if you're getting the foods that you need, if you're hitting all the food groups, then you should be able to function quite well and be physically active and not getting too tired throughout the day because you're getting enough sugars to fuel your body.
so so you're saying it's an individual thing.
Yes.
Though there are guidelines, but it's individual. So if somebody, I guess my question is, if you think you're at risk, can you call the clinic? Or
if you think you're at risk, then you should be connecting with your doctor's office so that they can
First.
do the blood work for you.
Okay, gotcha. Okay. Any other questions?
Thank you.
No? Okay, go ahead, Kim. Sorry. We are
doing.
doing sorry, Sunny, do you have a question?
I just wanna share something. Thank you, Kimberly, for this important information. No, I just want to share that my mother-in-law has diabetes, and when we start to research how to help her or how to reduce or to treat her illness, we realize that exercise is one of the of course, beside food, healthy food, exercise is so good. So it's funny because we are a very active community. So stretches, going out or doing meditation, yoga, it helps your body just to keep healthier when you have diabetes.
Yes,
So
very much
that's
so.
great for us.
Yeah, that's very much, we want everybody to be as physically active as they're able to. That's definite. Thank you for sharing that.
No, thank you.
Anybody else? And Debbie, did I answer your question?
Debbie, you're muted.
Yes, you did. Thank you.
Okay.
I was muted. I just gave you the thumbs up. Yes,
Oh,
I
okay.
think so. Yeah.
Okay.
I just know that I can't follow a guide because I'm wondering, I was just wondering if I was getting all my nutrients by not eating as much.
As long as you're trying to hit all the food groups throughout the day, then you should be getting, fulfilling your nutrient requirements.
Okay, thanks. I do have a very healthy appetite and I am active, but I just wanted to make sure that I was getting enough by not eating as much.
Yeah, no, definitely. If you're not eating as much, that's fine. Again, just if your energy levels are sustained, then you're doing okay. That's the main thing.
Okay, thank you.
You're welcome. Shall I continue? Okay. Okay. So again, trying to aim for that 30 to 45 grams at each meal, but guidelines. So you might need a little bit more, you might need a little bit less, just depending on your activity levels, your body mass index. So again, that's based on your height and your weight. So maintaining that healthy body mass index as much as possible and focusing on your energies. So diets and weight management, the best diet is the one that you can follow long-term. So there's tons of diets out there. Ketogenic diet is one that we hear about quite often, which yes, definitely works very well, but the majority of people cannot follow it for long-term. So we are gonna have people that come in and they did follow the ketogenic diet and they did it for a few months and they lost buckets of weight, but then they have a piece of bread because they really wanted that piece of bread. That throws their body out of ketosis and then they start gaining weight again. So it's something you want to find one that you can follow. There are lots of people that can follow the ketogenic diet for a long term, but you also want to make sure that your doctor is aware because they need to follow you with blood work.
So can I have a question there, Kim?
Yeah.
So that's even more dangerous, I would think, to go on that diet and then come off it again. And then, to have that going off and on a diet is not a good idea, my understanding.
It's not ideal, no, because every time you go on a diet, it can change your metabolism. So yes, there's lots of different diets out there. There's the Mediterranean, there's the ketogenic, there's the low carb, there's Atkins, there's lots of different diets out there. But every time you try a diet and you don't continue with it, it's going to impact your metabolism. Whereas if you follow lifestyle changes and you eat foods in moderation, you're not affecting your metabolism as much. And most people are able to do that. So most people are able to maintain a healthy diet and have that chocolate, have those chips, have that piece of cake every once in a while, but they're not going to change their metabolism. So their body's going to be able to use it and they're treating themselves, but they're not overdoing it. So that's kind of my motto in my office. And one of these days I'm going to get a plaque, everything in moderation, because we don't want to completely eliminate any foods. We don't want you to feel that you are deprived. We want you to be able to enjoy your life, eat the foods that you like, but just the foods that aren't great for your blood sugars or your weight management, you want to limit those. You want to reduce those. You want to treat yourself every once in a while, but not overdo it. So not having a large ice cap every day is ideal, but you can have a small ice cap once a month maybe, or depending on how your blood sugars are doing, depending how your weight management's doing. Just not bombarding your body with high levels of sugar all the time. So physical activity is, yes, very important in managing your diabetes. So diet is usually the number one thing people come into us with, but a lot of people struggle with the physical activity part, which I understand you ladies are not struggling with, which I think is fantastic. So Diabetes Canada recommends a minimum of 150 minutes of moderate to vigorous intensity aerobic exercise each week. So that's 30 minutes a day for 5 days a week, which most people can fit in. And that's walking, bicycling, jogging. All that helps with your weight management. That helps with your blood sugar control. It helps with your mental health. So these are very important things to consider when you're developing that that healthy lifestyle. And for some people in your lives, and I don't believe it's you ladies, because I think you are doing your 30 minutes 5 days a week, but there might be some people in your lives that you're saying, okay, well, let's get active, let's do this. And 30 minutes can seem like a lot for somebody just starting out. So for those people, you can say, hey, let's do 5-10 minutes. Let's walk down to the end of the street and back. Let's do that 3 times a day. And we just build on that. So say you can do the 5 minutes. Okay, in a couple of days, maybe we move it up to 7 minutes. Maybe we move it up to 9-10 minutes. And then eventually you can get to the 30 minutes a day.
So
So you-
Kim, we have on Women 10, we have chair yoga on Tuesdays, Zumba on Wednesdays that people can partake.
Perfect.
And but I like the last piece of this is start slow and work up, but give it a chance.
Yeah,
You know, if you haven't tried it, you know, and even walking, if you haven't been walking and you're not going to walk for an hour
no,
or climb mountains. We have some ladies here who can climb on their hands and knees, I think sometimes. Like they're adventurers for sure, eh, Joe? And they're doing some wonderful walks, but they're already, I don't think you really understand how fit you really are to be able to be doing that. So
Yeah.
that's not what you see in your office, I don't think, Kim. You know, and so that's the issue. We were talking before, saying that we have choices. And to choose to be well is a wonderful choice. And I don't think anybody would say no to that. But you have to follow that with an action plan,
yes.
you know. But it has to be daily. It does, I
Yeah.
think.
And if you're able to do it 7 days a week, then all the better. But the recommendations are minimum. So minimum of 150, minimum of 150 minutes of moderate to vigorous intensity aerobic activity 5 days a week. So if you can do more than that, all the better to you. If you can do it 7 days a week, all the better to you. So again, just start slow, work up, and don't push yourself too much, because the last thing you want is to injure yourself and set yourself back. So listen to your body. If it's saying stop, then stop. And then just keep pushing that on the next day, push a little bit further. And eventually your body's going to allow you to do a little bit more activity every day. So I think it's wonderful that, Harriet, you've organized all this wonderful activity for everybody. If somebody's looking at doing some extra activities on top of it, there's lots of different things available. You can do YouTube, you can do a lot of cable networks have workouts on them. There's lots of different apps. I noticed some ladies have some iPads or smartphones. You can get apps that have some of those activities on them too. So trying to incorporate the aerobic exercise with the anaerobic. So that's kind of your weightlifting or resistance exercises. Trying to balance that out a little bit, but trying to get some of that aerobic or anaerobic exercise in as well, because that really helps with your muscles or your bone strength. So if anybody's dealing with any concerns with osteoporosis, you want to make sure that you're getting some of that resistance exercise in as well.
And I think for aerobic, everybody knows that's with oxygen. Anaerobic is when you make it's a pretty intense a few moments, even that counts, you know, when you're just, you're going uphill and all of a sudden you're making a demand for more oxygen, that's anaerobic.
Yep.
That's not bad. You just don't want to do that too long.
No, exactly.
Yeah.
Keep those oxygen stores up as much as possible.
There's a good question in the chat box.
Oh,
Thank you.
where are we?
Yeah, is 1 hour per day for 3 days as effective?
It's definitely good if we're talking about weight management. If we're talking blood sugar control, it's not as great, but honestly, any activity that you're doing is going to be good for you.
So being active every day is not a bad thing.
No, it's ideal to be
Good
active
thing.
every
That's
day.
the ideal.
Yeah.
I
Does that
think 3
answer?
times. Oh, sorry. I think 3 times a week also, you're not building up any endurance that way.
Depending on what you're doing, so somebody can still be fairly fit if they're doing 3 times a day, if they're doing more intensive exercises. But if you're going for a walk 3 times a day, or sorry, 3 times a week versus half an hour every
Less than
day,
that.
then you're completely correct. You're not building up the same amount of endurance.
Good to know. Hey, we're in for life. This is good news. The rest of our lives. Woo woo.
Yeah, yeah.
And you feel better and you feel happier. You know, it's the ripple effect of exercise, I think. When I'm feeling down, if I go for a walk in nature, I come back feeling a lot differently. That's for sure.
I'm not surprised. Again, physical activity has so many benefits, and especially for mental health, it releases a lot of those good endorphins, those feel-good hormones that really help boost your mood. So doing that every day, if possible, is huge for many reasons. Any other questions, comments? Okay. So managing diabetes, if you have been diagnosed with diabetes, then there's different medication options for you. So if you get a diagnosis of diabetes, depending what that A1C result is, a lot of times we'll just start with physical activity and exercise. If you're already a pretty active person and you've been diagnosed with diabetes, and again, genetics, we can't fight genetics, unfortunately. So we can do our best with the physical activity and the diet, but sometimes genetics just gets the better of us. So there are different options for medications, and metformin is usually the first line. But I want to bring your attention to the first point again, is everyone's medication needs will be individualized. So it's very much dependent on what you need, how your body's working, what you can tolerate. But metformin is usually our first line, and some people can't tolerate metformin. It is known to have a lot of GI upset, but many people do really well on it if we start low dose and bring you up to the therapeutic dose. So that just means the dose that is actually working for a person. So what metformin does is, as I said in the beginning, is that we can develop an insulin resistance. Metformin helps with that insulin resistance and allows our body to use the insulin more effectively that we're already making. So that's why we tend to go with metformin first. It's been on the market for decades. It's a great medication. It does, like I said, have some GI upset side effects, but if you're able to tolerate it with no side effects and it doesn't affect your daily life, then that's typically the one that we go to. There are a lot of other types of medications, and there's research being done all the time. So I'm not going to nitpick into each of those because, again, it's very individualized as to what somebody needs. But I did want to mention insulin. So insulin is something that I hear about quite often, as people believe that if you're on insulin, it makes your diabetes worse. Insulin is a hormone that we use to control your blood sugars. It's just another tool in our tool bag. It helps to bombard those cells with the sugars and bring the sugars out of the bloodstream to help. It doesn't mean that your diabetes is going to get worse if you're on insulin. It doesn't mean that you can't go down on your insulin needs. So if you go to the doctor's office and you haven't been in a really long time and your A1C is skyrocketed up, you're just not feeling well, a lot of times we'll get the insulin on board, we'll get those blood sugars down, we'll get you feeling better. Maybe then you can start focusing on your lifestyle again. You can start getting more active again, focusing on your diet, because if your blood sugars are running high, that also has a huge impact on your mental health and is highly or closely related with depression, is high blood sugars. So we bring that down and then people kind of settle out. And sometimes just having those blood sugars down, restarting with the lifestyle again. Some people do go off insulin. Some people go off all meds. It just depends on, again, your individual needs. So complications of diabetes. So this is why we're concerned about diabetes. So if your blood sugars are running high, again, like I said, it's those red blood cells that are carrying the sugars to all those small vessels in your body. So in your brain, you have lots of tiny little vessels. In your eyes, lots and lots of tiny little vessels. In your heart, in your kidneys, your sexual health includes your nerves and your feet. So all of these are highly linked to complications associated with diabetes. So when I said with pre-diabetes, it makes you more at risk of complications associated with diabetes, it's mostly the eyes that we're focusing on. So you may or may not have heard of the term retinopathy. So retinopathy is the breakdown of the retina in the back of your eye that can cause blindness associated with diabetes. So having a higher A1C, it means you're more likely to have that bleed in the back of your eye that can cause you to go blind. Your brain, you're at higher risk of stroke, you're at higher risk of heart attacks if your blood sugars remain high. Again, if you're managing your diabetes well, if you keep your A1C down, preferably less than 7, even better if you can get it down to 6.5 or less, then you're much less likely to have any of these complications. Amputations, we hear of amputations with diabetes all the time. So what happens is people's blood sugars are running high for a long period of time. They're not taking care of themselves. They end up with nerve damage. They start losing sensation in their feet. So then their feet start to go numb, tingly. They might injure themselves. They don't feel that injury. And because our bodies naturally have bacteria on the skin, they now have this wound on their foot. The bacteria from the skin jumps into that wound and it infects it. They don't have any feeling in their feet. So then they don't know it's there. If they're not checking their feet, then they're not going to treat it. They're not going to treat that infection. That infection can become gangrenous, and then that leads to amputation. So that's where, again, keeping those blood sugars down means you're not going to have that damage to those nerves. You're not going to have the damage to your feet. You're not at risk of amputation. You're not going to have kidney failure. You're not going to have heart attacks unless there's other stuff going on. But diabetes is the leading cause of heart attacks in Canadian society right now. You're not going to have the issues with retinopathy for your eyes, and you're decreasing your risk of stroke. Again, there's other genetics that have to deal with that, but this is all diabetes related. Any questions on the complications?
I have one where time is getting short here, but I was wondering, did you see an increase in diabetic related cases during COVID? I'm just curious about that. Do you know what I mean?
So interestingly, the ones that we did get were ones that are coming in with really high A1Cs, mostly because they're going to emerge. So during COVID, because people weren't going to their doctor's offices as much, they weren't getting screened, and then they were ending up at emerge, not feeling well with really high blood sugars, really high A1Cs. So I would imagine as people start going back into the offices, going to see their blood or their doctors, getting those blood work done, we're going to be seeing a higher increase in people with diabetes, because a lot of people just weren't taking care of themselves the same way with COVID. Any other questions? Okay. So I think this is my last little section here. Yeah. So
Could you go back to that? Yeah, that one right there. Yeah.
So mental health and chronic disease. When someone is diagnosed with chronic illness, there are many emotions tied to it. So a lot of people will be frustrated about the diagnosis, they'll be angry about the diagnosis, or they'll go into denial. They may feel guilty if they indulge in a certain food. They may feel sadness, confused, but they can also feel some hope and relief and opportunity when they start seeking the help. So denial is something that can cause a lot of people to not take care of themselves properly. So it is whenever you're diagnosed with a chronic illness, there is an element of grief that goes along with it, because you now have to go through all those grief emotions to actually accept the fact that you have a diagnosis of a chronic illness, because this is something you're going to be living with for the rest of your life, and it's taking away part of that previous life that you had before. Denial can be very troublesome when you're dealing with chronic illness such as diabetes, because then you're not taking care of yourself as well. The guilt, again, I want to reinforce, we're not saying that you can never have that treat. And that's what I'm calling it. It's not a cheat, it's a treat. You can definitely have that treat guilt-free, because you know that it's in moderation. You're having that small piece of cake versus 3/4 of a pie. But you're getting that sugar indulgence that you quite enjoy. You're still living your life, but try and realize that as long as you're doing the healthy living, healthy lifestyle the majority of the time, you can enjoy that piece of cake or that donut guilt-free, as long as you're not indulging all the time. There is lots of confusion as to why, especially if you are living a healthy lifestyle and then all of a sudden you're diagnosed with type 2 diabetes. Again, it's genetics, and that's a component that we can't overcome. We can deal with it, and we can do our best to help you maintain that healthy lifestyle and bring on the medications to keep those blood sugars down to prevent those long-term complications.
I like this. I like this slide.
So it's very, very
Yes.
important to realize that there's a huge mental health component when dealing with any chronic disease, because with diabetes especially, it's a 24/7, 24-hour, 7-day-a-week job. Like, there's no break from it. But just maintaining that healthy lifestyle really helps to control your blood sugars, keeps you in that better headspace, and allows you to just have that hope, that relief, being educated, that you can live a normal life.
What is, question?
Yeah.
What is moderation? Once a week, once a month?
Depends what we're talking about. So if you're having, I'll say even every day. So if you're somebody that loves your after supper dessert, then we just have to include that into your 30 to 45 grams of carbs. So if you're having, say, a basic meat and potato dinner, you know, half a cup of mashed potatoes is your 15 grams of carbs. So maybe you have a cup of potatoes or a cup of rice. There's your 30 grams. Then you have a 15-gram snack or dessert. Maybe your dessert is a little bit bigger. So maybe you just have your meat and your vegetables that day, and then you enjoy that bigger slice of cake. So you can still enjoy it. You can still have it. You're still having the proteins and the veggies. You're getting your fibers from the veggies, but you're able to enjoy that piece of cake knowing that you're not going to send your blood sugar skyrocketing high. Something like an ice cap, which I know it's not really the season for. Maybe let's say you go to Twigs and you get a pumpkin spice chai latte. I wouldn't recommend that every day. And I would recommend the smaller one versus the bigger one. So again, it's really just going to depend on what you're indulging in. If you're somebody that enjoys a glass of wine, enjoy your glass of wine. Just follow the recommendations set out by Canada's guidelines. And I believe for women, it's 1 to 2 drinks a day.
We have 3 minutes left, Kim.
Okay. So mental health. So know that you're not the only one if you have been diagnosed with prediabetes or diabetes. In 2015, 9.3% of the Canadian population was diagnosed with type 2 diabetes. 22.1% of the population was diagnosed with pre-diabetes. There's lots of support groups available. If you have been diagnosed, seek help. If you're having troubles with feeling down, depressed, or hopeless, seek help if you're losing interest in the things that you enjoy doing. There's lots of social workers associated with doctors' offices. We have one on staff here. There's one, again, with the Blue Sky group that can help guide you and normalize these feelings. But support groups, I can't emphasize enough how important they are for people to realize that they're not the only one dealing with mental health and chronic disease. Social workers, they're just a wealth of knowledge. So I definitely encourage, if you're dealing with any sort of chronic disease, to seek them out and talk to them, and they can help guide you. Any questions?
I think you've had a lot of questions. This is, and I know your mom must feel so proud of you right now. This is a great, great presentation. Thank you, thank you, thank you.
Oh, thank
And
you.
you know, Living Fit's been going for 25, we're in our 26th year, but I gotta tell you, it's nice to hear this information again. And I'm really glad you're coming back for part 2 next week, because I think we all need reminders, and there might be something in there that will help us make better decisions for ourselves. And so Kim, thanks so much.
Oh, it's been my pleasure. And I just ask, since I don't really have anything prepped for the next session, prepare your questions. I am here to answer any questions. And if you want to let Harriet know in between, if there's certain topics you would like me to cover, maybe Harriet, you wouldn't mind sending that along, and I can definitely.
Sure, I'll try to do that.
Yeah.
Otherwise, you know, it might be nice to look at some actual meal planning, if you
Sure.
can do that.
Yeah.
And anybody, you think so? Okay, even a sample for a week to see what would it look like, you know, based on our body mass index. You know, what might it look? I know that's not the only indicator. Your waist size too is important, right?
It's huge. Yeah.
Yeah, it's
usually-
huge. If it's, and that's something you might want to cover. Just a few more details.
Yeah.
And, you know, we can always do a little bit better, right? Do more good for our bodies. So if you have any questions, I'll put them aside and we'll bring them up during that meeting. And maybe in the meantime, you can have a look at those websites. What was the main one? Is the Canadian
Diabetes Canada.
Diabetes
Canada.
Canada.
Yeah.
Diabetes Canada. Have a look at the website and see if there's something that triggers a question in you, okay? Thanks so much, everybody. Let's go out and exercise. Woohoo!
Thanks so much for having me, ladies, and enjoy your exercise.
Wonderful. Thank you, Kim.